Almeca Hospital opened up on the 7th of January 2013. Its main service was to render services to the HIV vulnerable people. It normally registers high turn-up and it's known for being the most reliable hospital for blood transfusion in the whole of Busoga region, but also gets patients from the neighboring regions of Buganda. Poverty and diseases is not a new term to this region, and there are many that can't afford the hospital bills, so they are given on a subsidized amount. Also, maternity services, they are free of charge, and mothers also get free antenatal services and free immunization services. Almeca Hospital is almost being used as the main backup hospital in the region, having one of the best scan machines for many of the people that need these services. The dental section is another of the sections that also receives a number of people in the region, employing one of the best dentists in the region. The hospital has also taken the initiative of having health education to the community that many of the people benefit from, especially the community. This has also boosted the free tuberculosis and HIV testing that has been done here, free of charge. The services are free of charge, 24 hours, 7 days a week. Almeca has got the state-of-the-art theatre machines that has managed to save the lives of many in the region. One of the key challenges is that the number of people that turn up here are overwhelming. Another challenge is that some of the wards are not completed. That would be offering some of the best services for many of the people due to the high number of people that come here. The ambulance is one of the main and core elements of the hospital, but one is not enough, as the hospital would be better placed if they could have at least 2 of them. Another boost to the hospital would be the need for volunteers to reduce the cost of paying some of the services that are rendered to the hospital, and this won't be a problem to accommodate the volunteers as the rooms are available at the hospital for their stay just annexed to the hospital premises. Victoria Junior Academy is a day and boarding school that was started in November 2012, offering subsidized amounts of fees to the community. But the children who are orphans from Save the AIDS Orphans Uganda are studying here for free, and other disadvantaged children. This started due to the number of orphans that was very high. It's having a section of preschool and primary section. When it all started, it had a population of 60, but to date, it's running with a population of 750 children, with 100 children not paying for their school fees. The utmost challenge is that the school library is not fully equipped with textbooks, and also they need the school bus as many of the children trek long distances. For the school fees that is collected from the parents is still very minimal. The administration block and the staff quarters is still in dire need of improvement. However, in terms of grades, the school has shown better grades compared to any other school in the community. And as for the orphanage, it started in 1997 by Nelson Lufafa from evangelism and praying for the sick who are living in abject poverty and couldn't afford to have a meal for a day. In 2012, the demand came high, then they had to strengthen Save the AIDS Orphans Uganda organization by creating and making it more profound as the number of HIV and AIDS children kept growing. This facility was built for them, as they have also got a church for themselves for their worship here. The children have now got their own accommodation that they boast of, and their hygiene has been improved with clean water reservoir and better toilet systems. For medical services, they all go to Almeca Hospital that's under one foundation. They don't need to pay for drugs and treatment. One of the challenges that the organization faces is the school fees for the students for the next level, that is after primary section. Sharon Nakavuma is one of the beneficiaries from the orphanage and talks of how it's been home and now working with the orphanage.
We have had so many beneficiaries at the children's at Save the AIDS Orphans. We have had so many beneficiaries, which I'm also part of. But because we do not have enough space, we didn't have that much space, so we had to cut the number because of the space and the funds that were coming in. So right now we are looking after 50 children at the children's home that are living with Agape Children's Home right now, and we have 100 children that are living in foster homes. The ones that are not in the children's home, the ones that are in the foster homes, we have widow groups that we empower, so that widows try to help us look after the children. Other children don't really stay with the widows. They stay with their guardians and parents, but what we do is we support them. We support them with basic needs. We pay their tuition, we give them medical, and then we buy for them beddings, books, like we do those other things, but they have shelter already that is provided by their guardians. The main major challenge is about the meals. These children have only one meal from January to January. Definitely it feels no one can have a healthy life, a healthy living while having only one meal. So their daily meal is posho and beans, where this also affects them with their mental, their psychological, their development. It really affects the children because they need to have a diet. And since we also have a few children that are HIV positive, they also need a special attention, which special attention we cannot only give to them, because we also have other children that are still really young and they need a special diet. Over buying a piece of land somewhere so that we do farming. I think when we do this farming, it can help us, it can help the kids. There are so many things involved. They can learn how to farm. We can also be harvesting, getting food, so that it can help the kids. They can eat, like they can have different fruits. We can plant tomatoes, we can have greens. We don't need these kids to eat meat, but we need them to have a good healthy life, so that it helps them also in school, because recently they have not been really performing so well at school. Well, not because they're dense or they're stupid, but I think because of a few things that maybe like food, like there are certain things that they really do deserve, they really do need to have. It's like a basic need for a child to develop. Yeah.